I'm great. So I was asked to talk about just my clinical practice. So I work in the Fetal Center, which is a large referral center here in the Southeast, which receives about 1,300 patients per year. And in the Fetal Center, we focus on prenatal diagnostics. So we work with maternal-fetal medicine for the ultrasound, incorporating maternal physiology with the fetal diagnostics. This really relies on pediatric cardiology and the other subspecialists. So once we kind of diagnose a condition, we really involve the subspecialists early to help bridge the care from the antenatal to the postnatal care pathway. So a fairly large volume, 1,300 ultrasounds per year, but really this is a medical home model in which patients come see maternal medicine, which focuses on keeping the pregnant patient safe, but then beginning to outsource the care to the pediatric specialists. So that's kind of a fetal focus. I also work in the Center for Women's Health, which is really maternal focus. So women with cardiac disease, there's a cardiac clinic or an endocrine disease. So each of these subspecialties has a certain day of the week in which they work. And so, for example, in the heart clinic, we'll have a higher volume of patients with heart transplants who are there with their pregnancies. So this is kind of where we encounter patients with pain syndromes. Here of note in this clinic, we have a maternal addiction and recovery. So four clinicians work here for patients with substance use disorders. So I know not using it necessarily for pain, but we have a good experience there for using narcotics during pregnancy. Then lastly, kind of merging kind of my multidisciplinary effort is working in the Center for Bioethics and Society, which we help to help with the institutional decision making for complex research needs and clinical needs. So I'm here to help, and I'm happy to be on this panel to help give clinical perspective. Thank you.